Hi folks, my name is Brittany Fournier and I did my quality improvement project on the impacts of standardized bedside shift report tool to improve unit-based bedside shift reporting. So bear with me, I'm hoping you can see the screen okay. So for the background, clinical information transfer among healthcare professionals is undoubtedly one of the most integral components of delivering safe and effective care. Despite care level or clinical specialty, communication inefficiency remains an insidious contributor to medical failures and increased patient mortality and morbidity. Lapses in communication commonly occur during transitions of care when one caregiver relinquishes patient care to another. According to a survey performed by the Joint Commission, almost 70% of Sentinel events were the result of communication errors, including those that occur during handovers. Regarded by the Joint Commission as a core safety strategy, bedside shift report is a comprehensive process involving the exchange of critical patient information between outgoing and oncoming nurses. Ideally, this exchange of information will occur at the patient's bedside and with the patient's participation. All right, so I'll try to make this quite brief. In our introduction, you're certainly welcome to take a peek at this. It's really just a summary or a condensed version of my paper, but the reason it's so applicable is because our hospital consumer assessment of healthcare providers and systems, which is our HCAHPS scores, it's a national survey instrument that examines patient experiences and data regarding clinical outcomes, patient satisfaction, healthcare associated infection, values, nurse staffing ratios, patient safety, etc., are all quantified. And then they summarize it annually for a hospital report card, for which patients can take a look at and determine if this is a place where they'd like to receive their care. The first quality indicator observed is the patient experience with healthcare related communication amongst nurses. And data from 2022 suggested that 20% of patients or participating patients felt that the nurse failed to communicate health information well. Our cardiovascular care unit comprises 32 single patient rooms positioned along a curved corridor. The patient population is generally unstable, requiring critical intervention related to acute coronary syndromes, myocardial infarction, arrhythmias, heart failure, cardiogenic shock, all of the above, all things heart. In lieu of the many complexities of cardiac illness and their care, successful knowledge transfer is important. Our HCAHPS scores actually motivated a review of our unit's November to December bedside shift reporting and our scores to determine if improvement was actually warranted. And the findings suggest that our bedside shift reporting compliance for November to December of 2022 was actually 46%. So we had some work ahead of us. This unit-based quality improvement project aimed to improve healthcare-related communication regarding individual patients during shift changes with a goal of improving bedside shift reporting compliance by 30%, which would actually raise our total BSR compliance to approximately 75% within the next 2 months, or the last 2 months, rather. So my aim statement was to really improve healthcare-related communication regarding individual patients during shift changes and nurse handoff. I aim to identify nursing perceptions of bedside shift reporting and establish a standardized reporting tool to improve unit-based nursing BSR compliance 30% by February 14th of 2023. We wanted to educate and define the requirements of quality nurse handoff and survey at least 75% of nursing staff in our cardiovascular unit. So therefore, pre-implementation e-surveys and e-polls comprised an online qualitative inquiry regarding nursing perceptions of bedside shift report and perceptions of a standardized bedside shift reporting tool to improve compliance. Those pre-implementation e-surveys and e-polls were conducted over 2 weeks. They began circulation on December 8th and then they closed on December 22nd. We had 2 education days that were held during that pre-implementation phase to just kind of boost the morale and get people more involved. We also examined all pre-implementation data. We identified e-survey consistencies and established a standardized and simplified bedside shift reporting tool to promote compliance by the end of week number 3, which was December 28th. And I'll show you a timeline that we tried to stay very tight with. Let's see. So data regarding compliance was collected over a 4-week implementation phase, and that was January 3rd to January 27th. And then we circulated a post-implementation e-poll over the final 2 weeks, which was January 28th to February 11th, which gave us a very little amount of time to try to analyze all the data and condense it for our results and our conclusion, which we ultimately closed on February 14th. So this here is just an idea of what our timeline was. As you can see, our pre-implementation e-survey e-poll went out, and these are the dates here. We introduced a standardized bedside shifting report tool. For some reason, I couldn't get it to upload, but ultimately it was really just a tool that we could read from left to right that simplified and condensed your nursing report. So it made bedside shift reporting easy, and it actually was very beneficial to a lot of our newer interns and our new staff. Nonetheless, this is the data compliance data collection timeline, our post-implementation e-poll, and our conclusion of our QI project. Our design is here. It was really a tri-basic quality improvement project within the cardiac care unit. We talked about the pre-implementation phase, the implementation phase, and then the post-implementation. I'll just, for the sake of time, we'll keep going on with the PowerPoint here. So our strategy, IHI's model for improvement was the PDSA cycle. It was utilized as a framework to guide this quality improvement project. The PDSA tool is a systematic methodological approach used to acquire knowledge for continuous improvement. The PDSA cycle is useful for determining objectives for QI projects. How can one discern if changes are improvements, and how can one make processes or process adjustments to yield results that demonstrate actual improvement? So that was our strategy. Our PDSA cycle, we talked about the pre-implementation phase, the e-surveys, the e-polls, everything that had gone out initially. And so I'll give you a little bit of numbers here. In the pre-implementation phase of the PDSA cycle, it consisted of both a qualitative e-survey to examine nursing perceptions of bedside shift reporting, which helped guide the conversation on our 2 education days. The e-poll assessed the nursing perceptions of a standardized BSR tool. And when I say BSR, I mean bedside shift report. And so the pre-implementation e-survey and e-polls, like I said, began circulating in December of 2022. Our compliance rate, so nursing perceptions of a standardized BSR tool to improve BSR compliance, 33 of 59 nurses completed both surveys, actually yielding about 56% participation, and originally we wanted 75% of nurses. That was kind of our goal, so we got close. There were a few consistencies that were true for most of the participating nurses, in that they all agreed that bedside shift report improves quality of care and quality communication. They did say that a modified approach was appropriate at times, and they also weren't very sure if it mattered that a bedside shift reporting tool that was standardized would make a difference. During all of the pre-implementation phase and the implementation phase, we were collecting data on compliance rates and the number of nurses that were actually going in and doing bedside shift report as well, and you'll see that in our future slides here. Let's see. Results. So we talked about how I was really hoping to get about 75% of nursing compliance for the e-surveys and the e-polls. We got about 56% with this. The e-polls were circulated along with the e-surveys, and they ended at about week 6.
The e-polls, they actually inquired how likely are you to use a standardized bedside shift reporting tool. And of course, 33 of 59 nurses, which was 56% of the staff, yielded information. The post-implementation e-poll accrued fewer compelling data as it yielded responses from only 20 of the 59 nurses, which was 34% of the staff. We did trend, as I said, the compliance data to evaluate if there was any correlation between the introduction of the standardized bedside shifting report tool and whether that, improved bedside report. This was the actual graph pre-implementation phase of how likely will you use the standardized bedside shift report tool. And as you see here, a lot of them were pretty unsure. The orange stands for somewhat likely, blue is highly likely, and gray was not likely at all. At the end, in our post-implementation phase, we found that nurses were actually more inclined to use the standardized bedside shift reporting tool. And those that did, so about 50% of the staff, so in the pre-implementation phase, 48% of the participating staff indicated that they were somewhat likely to use the standardized bedside shift report. And then at the end, in the post-implementation phase, about 50% of them said that they were highly likely to use the bedside shift reporting tool. So we found that it did have a positive effect on the unit. And 100% of the staff that participated in those surveys actually used and continued to use the BSR tool. This is just data. It's a data table. This is just to quantify recorded bedside report compliance. And these are our actual, like our maximum unit census, the compliance rates, and then the percentage. So our daily compliance percentage. And at the end, I averaged everything out, and we made it to 73%. So it's pretty successful. So in terms of results, I think we kind of talked about all of this. Ultimately, oops. Well, that's silly. So ultimately, we had about, approximately, 56% of our unit that participated in the e-surveys and the e-polls. And regardless of the number of folks that participated in the surveys, we did see a lot of active participation on the floor, and we got about a 73% success rate. So we definitely, I think it was 26% improvement, and our original goal was 30%, and with an overall goal of a 75% improvement. So as confusing as that may sound, we nearly met our goal. I think had we had more time, we'd have been a little more successful reaching those numbers. And I think since I've closed this quality improvement project, a number of people have kind of fallen away from doing bedside reports. So there would be some interesting data going forward, and I think we'll continue to kind of research this and push it on the unit. I've taken enough of your time. I hope that this wasn't entirely confusing. It was really fun, and it was great to get to know all of you guys in our conversations and our discussion board. Good luck with everything going forward.